This season of This Headache Journey is sponsored by gammaCore non-invasive vagus nerve stimulator, the drug-free solution for migraine and cluster headache. gammaCore is the first and only FDA-cleared non-invasive device to treat and prevent multiple types of headache pain via the vagus nerve. It's small, handheld, and portable for quick and easy treatments whenever and wherever needed. gammaCore is safe, effective, and easy to use. Learn more at gammacore.com. That's GAMMA core.com. Hi, I'm Adam Flaherty, and welcome to episode 10 of This Headache Journey. I've created this podcast for you, fellow member of the Chronic Headache Club. Over the years, I've tried so many different interventions and modalities, desperately trying to reduce the frequency and intensity of my chronic headaches. I'm sure you have too. Well, in this podcast, I'm going back through them, sharing my experience with them, and then bringing in an expert to share the science behind why these modalities work for many people. Because even if it wasn't the magical unicorn that cured me from chronic pain, it could be a life changer for you. To that point, it could also be a life changer for someone you know who's lucky enough to be in the club that we're in. So please take a moment to share this episode with them. And if you haven't, please subscribe to the podcast and leave a review so that it can reach as many people and impact as many lives as possible. Today's episode centers on the relationship between sleep and chronic headaches and migraines. And before I get into it, it's important that I remind you that I am not a doctor, and nothing in this episode constitutes medical advice in any way. My goal is to give you more tools in your toolbox that you can bring to your PCP, neurologist, or headache expert who can work with you to customize a path for you on your headache journey. For as long as I can remember, I've had these chronic daily headaches. Also, for as long as I can remember, I've been able to fall asleep very easily. If I'm a passenger in a car, before too long, I'm asleep. If I'm in an afternoon meeting that's really dragging, I'm probably fighting to stay awake. If I'm watching a movie, even in a theater, I'm probably dozing off, and this goes back many years. Maybe this resonates with you too. While I've been aware of it, it didn't occur to me for a long time that there could be an underlying issue. And then at some point, I couldn't ignore the correlation between when I had a bad headache and when I was the sleepiest. A neurologist I was seeing when I was in my early 30s suggested two things. One was a medication called Provigil, which essentially just sort of helps you stay vigilant and awake when you do have a headache, and I still take that almost daily to this day. He also referred me to a local sleep clinic. I went through that process, checking into this sleep clinic practice at 7 or 8 p.m., getting a rundown of what would happen, being covered in these electrodes and leads and wires all over my body, and then trying to fall asleep in an uncomfortable bed with all of this stuff on me, trying to ignore the fact that it was literally someone's job to watch me and monitor me all night. Unsurprisingly, I got a poor night of sleep, and I learned from the report that I had, quote, moderate obstructive sleep apnea. I learned that this is actually fairly common and that there were several dozen interruptions in my sleep, probably happening every night. I would snore periodically or hold my breath for periods of time, things that didn't wake me up to full consciousness, but certainly reduced the quality of my sleep, and as I'd later learn, could contribute to long-term health problems. The prescription for this was to wear a CPAP machine. It sounded pretty awful, and spoiler alert, even years later, it still doesn't make my list of favorite things. If you don't have experience with a CPAP, the letters stand for continuous positive airway pressure. There's a smallish device that sits next to you on a nightstand. A tube connects to it, and at the end of the tube is either a mask that goes over your mouth and nose, or an accessory that fits into your nostrils, and then a strap that goes around your head to hold this to your face. I quickly figured out that the full mask was the right option for me. Now, it's important that there's a tight seal against your face, and when there is, just like the name suggests, the machine pushes a constant stream of air through the tube. You can manually adjust the pressure and other variables like the temperature and the humidity level of the tube, but I found that letting it kind of auto calibrate works best for me. It definitely took a bit to get used to wearing the CPAP, but now it's basically just a mild inconvenience and I can sleep fine with it. But along with the device, at least the one that I got, there is a companion app which gives you data on your sleep quality. And I quickly found that with the CPAP on, my sleep interruptions went from the high 20s to the low single digits. So my quality of sleep is significantly higher when I'm using the device. Now, I mentioned earlier that sleep disorders are far from rare, and many go undiagnosed until someone goes through a sleep study. And also that undiagnosed sleep disorders over an extended period of time can lead to problems down the road. But since I'm not a doctor or a sleep specialist of any kind, I invited Dr. Alison Kole, aka the Sleep MD, to educate us all on this relationship between our sleep habits and sleep health and chronic headaches and migraines. Dr. Allison also hosts the podcast Sleep is My Waking Passion, which I'll link to in the episode notes. All right, here's our chat.
Hello, everyone. I'm Dr. Alison Kole. I'm a pulmonary critical care and sleep medicine physician. I myself have had chronic insomnia for well over 20 years at this point, and I found a better way to sleep and have pivoted my career to really be focused on that. It's a pleasure to join you today, Adam. Thanks for having me.
Thank you for making the time for this. I want to spend the next little bit talking about the relationship between sleep health, the amount of sleep we get, and chronic headaches and migraines. So for people who maybe have never thought about the quality or quantity of their sleep affecting their headaches, can you explain at a kind of a high level what that relationship is?
Sure. So to think about sleep, think about it as sort of something that will improve your headaches, but conversely could make them worse, kind of depending on your relationship with sleep. What I mean by that is when we talk about what makes up optimal sleep health, and I don't speak in absolutes, by the way, because we live in the real world and life is just imperfect. But if we're looking at the three sort of main buckets, you have consistency of sleep, so having a routine schedule is important. You have sleep duration, which is also important, getting sufficient sleep for you and your physiologic needs, which varies from person to person. And then you have sleep quality. What makes headaches interesting is it seems like, well, if I just get more sleep, everything's going to be fine. And the data does support that if you can prioritize getting enough sleep again for you, which roughly maybe 7 to 9 hours for the majority of us. Very few of us need less than that. That might help your headaches because you're at least giving yourself enough time to sleep. But the data really suggests more strongly that it's the quality of sleep that perhaps is the biggest thing that you need to focus on. So once you get the duration down pat, you're still having headaches. I think the question is, can we somehow improve sleep quality? Maybe it's the behaviors that you're doing that are disrupting your sleep. If you have the TV on all night and you're constantly having these little wake ups, do you have a bed partner who makes a ton of noise and disrupts your sleep? Or by bed partner, I mean human or non-human, like dogs and cats. And, I have some patients that love to sleep with their pets. It's the worst, but I know I'm not going to be able to change them. Do you have a really inconsistent schedule? So see, these are some of the things that you really want to think about when it comes to improving sleep quality. And that often translates to a less headaches because better quality means you tend to be sleeping for longer. You tend to have fewer disruptions from sleep. And those things really matter long term.
So for someone who gets that 7 to 9 hours and is getting good quality sleep, What are you seeing typically for a number of interruptions for somebody with like what you would consider a very healthy amount in quality?
I think it ultimately depends on your perception of those disruptions as well. So if you kind of know that there's something amiss with your quality, most people may wake up and not really feel like they've had a great night of rest. Sometimes they can't pinpoint what that is. Sometimes it may be because they have to get up and use the potty multiple times a night and go to pee. Some people will note that they're waking up and having some other symptoms. Sometimes it's just, hey, I'm waking up feeling kind of anxious. Or maybe they have a bed partner that's telling them, listen, I don't like the way you sound when you're sleeping at night. It sounds like your breathing is irregular. There may be clues. And one of the things is we are not our own best observers of our sleep. So if you have a bed partner or you go on a trip and someone flags something to you, even though normally you sleep by yourself, take the witness account seriously in that situation because you have no idea what's going on. And if there's a question, this is where talking to your primary, talking to a sleep specialist, if you have accessed one, this is what we do all day. So we can really be, I think, a great advocate for you in terms of getting you where you need to be with headaches and looking for sort of organic reasons for your sleep to be disrupted, meaning are there underlying sleep disorders potentially that are contributing?
Thank you for that. Yeah, and I do want to get into sleep disorders momentarily, but I guess would you say anybody who has been suffering from chronic headaches or migraines for really any length of time, it would be worth them seeking out a sleep doctor or a sleep clinic to explore this, even if they haven't been, told by somebody else that their sleep seems irregular, or even if they wake up feeling rested?
When I think about sleep, I think, okay, if you're not really kind of sure where you should go, there may be some things that you could do just even in the home before you're reaching out for that sleep specialist,
Yeah.
spending that money on that consult. It might even be, and I judicious use of sleep tracker type of devices.
Hmm.
Maybe your Apple Watch is flagging, hey, your oxygen levels seem to dip. That's a little unusual. That might cause you to want to get checked out. Maybe it's noting, hey, and these are loose terms. So, anybody listening, please do not get obsessed with what the data is. But if it's showing you, hey, it seems like you have a lot of sleep disruption or you don't get a lot of deep sleep or REM sleep. Again, these trackers were never designed to be perfection. They're not replacing sleep testing, but they may be flagging to you that something in terms of your sleep quality is amiss. If even if you had something as simple as one of these apps that records snoring, you could see, hey, am I making funky noises or doing anything in my sleep, even if no one else is mentioning that to me? I think having a low threshold to get your sleep assessed and formally have a conversation is just low hanging fruit because what do we do? Do I do an invasive procedure on you? No. Do I even draw blood most of the time? Sometimes there may be labs that might be helpful depending on your particular symptoms, but in general, we don't do anything really invasive. A sleep test often can be something as simple as monitoring your sleep in the comfort of your own home, maybe seeking out more specific data points within a laboratory setting, depending on what your symptoms are. And so it's a fairly benign process to get your sleep assessed, is my point, and relatively inexpensive nowadays with home testing. So you can really have a very quick and more professional assessment of what's going on. And if you're really suffering and it's decreasing your quality of life, potentially impacting your ability to function during the day, hold a job, be present for your children or your family, why would you not? Life is short.
How common would you say that, undiagnosed sleep disorders are for people who have chronic headaches? Is it Let me give an example. In my case, and this was 7 or 8 years ago, maybe even more, I had no idea that I had, moderate obstructive sleep apnea. I have always just understood or maybe assumed that my sort of sleepiness during the day was just attributed to or a result of my chronic headaches sort of fatiguing me. And a doctor recommended that I see a sleep specialist. I did the test in a sleep lab, and sure enough, obstructive, moderate obstructive sleep apnea, and I've been using a
Mhm.
CPAP ever since. But for other people who, maybe feel sleepy during the day, don't wake up feeling rested, and they have these chronic headaches, is it very common that there is a sleep disorder that is causing that?
I think it depends on how you examine the literature, meaning that headaches are incredibly common if you're having, again, poor sleep quality, a lot of disrupted sleep. And if you're looking specifically at obstructive sleep apnea, roughly a third of patients will complain of headaches.
Mm,
Um, a lot more people, perhaps, are aware of grinding their teeth,
mm,
usually because they're going to the dentist, and the dentist is like, hey, you need a mouth guard. I notice grinding. And sleep related bruxism, which is basically grinding your teeth at night when you're sleeping, which is this movement if you're rubbing your teeth together, is really sort of a activation of our sympathetic nervous system. And depending on how you ask the question, up to 80+% of people who have sleep related bruxism may actually have obstructive sleep apnea. It's about a third or so of patients with sleep apnea will find that they also grind their teeth. The relationship to headaches is a little bit less conclusive with grinding your teeth, but I bring it up because there's such a strong association with sleep disordered breathing. But other types of sleep disorders also can cause you to maybe increase your risk of headaches. So, if you're someone such as myself who really struggles with their sleep, so getting to sleep and maintaining sleep are a big issue for you. And so the total amount of time that you're getting is kind of disrupted because some people end up having chunks of time that they sleep because of their insomnia. They're just trying to get enough hours. So they may sleep for 4 hours here, and then they're up for a couple hours, and then they're trying to kind of nap for an hour or two before they head off to work just so they feel like they can function. Those people may be more prone to headaches. And then you have things like restless leg syndrome, which is pretty common in our population. And restless leg syndrome can be oftentimes associated with decreasing your ability to fall asleep, just because most patients are kind of aware of those symptoms. But sometimes once they fall asleep, they may be having restless legs and they may be kind of unaware of that. And things like a polysomnogram can help you kind of pick that out and tease it out. The flip side is that headaches also disrupt your sleep often, because if you're going to bed and you're in pain,
hmm
it makes it even harder to sleep. So it becomes like this vicious swirl, because if you're not sleeping well, that kind of aggravates the headaches, which makes it harder to sleep, which aggravates the headaches.
Yeah, that is a treacherous cycle, and I often think about if I go to bed with a really bad headache, that the sleep is sort of the break from the headache, but when I wake up with one the following morning, then I wonder, did I have this pain all night, and how did that affect the quality of my sleep?
Well, I wanted to just add that you brought something up about obstructive sleep apnea and your personal journey. And
Yeah.
I'm curious to see what your thoughts are, because, in terms of headache resolution, the literature points to maybe up to 80% of people having their headaches actually resolve once they're on CPAP therapy. So the majority of people having resolution of their headaches within 72 hours or so. I think it's going to be a little different if you're somebody who's had headaches for a very long time or significant migraines, but often addressing the underlying sleep disorder, which then addresses the sleep quality piece of it, often does improve at least the frequency of headaches, even if it doesn't make it perfect.
Yeah, and I love those statistics, and I think that could be really inspiring and exciting for people who are listening who haven't explored the quality and quantity of their sleep. For me, it didn't have a direct impact on my headaches at all, but I do know that from doing this sleep test in a lab years ago that I was having multiple interruptions, something like in the high 20s or 30s in interruptions a night. And, it went down to single digits, like low single digits. So I do know that the quality of my sleep is greatly improved. And there are many other benefits to that come from consistent higher quality sleep, but it wasn't the thing that helped with my headaches specifically.
That is a real bummer, but Because, I was hoping to hear, oh my goodness, yeah, my headaches were a lot better. But
Yeah.
it sounds like it's a little bit more complex, but you're still, even if and for those listening who are suffering through their headache journey, just knowing that your sleep is so intimately tied to your headaches, I think is just a really important point. So I'm really happy to be here to talk about that because it's probably one of the most surprising looks that I get in the office is people are like, well, I don't know. I've just lived with headaches my whole life. Like, what do you mean? And I'm like, well, it could be sleep apnea or another sleep disorder. And we talk through it. And then I do often, again, it's not everyone, right? There's still going to be 20% of people where that's not going to be the fix. But so many of us may at least have some improvement, and you're just knowing that you're doing something better for your health overall because it impacts not only what's going on in your head, which is what you've got to deal with on a day-to-day basis, but it also impacts all the other organ systems, right? If we're getting
Right.
specific related to sleep apnea, we're talking high blood pressure, we're
Yes.
talking diabetes risk, we're talking cardiovascular risk in terms of major adverse cardiac events, what us nerds like to, discuss, but really comes down to things like strokes and heart attacks, like bad
Right.
stuff that picks us off the planet sooner.
Right. So despite, not loving being tethered to a CPAP, all night, I stick with it because of all of those reasons. And a big part of this podcast is that even though many of the things that I'm going back and revisiting weren't the magical unicorn that fixed my headaches, I know that they can be so effective for other people. And so that's why I wanted to dig into this with you, because there is such a high success rate for people with chronic headaches and migraine when they get into a program like, CPAP for sleep apnea, that even though it's not the thing that cured me, it could be something that makes a huge difference for them.
Absolutely.
I wonder if you can share a little bit about what is maybe physiologically happening when somebody has irregular breathing or is snoring in their sleep. Like, what's actually happening in their airway that can lead to all of these longer term problems that you were just describing?
I like to describe the airway, and this is how I talk to my patients even. So this is kind of fun because I get to just, pretend like you're my patient and we're having a chat, and this is what you'd be talking about in my office. When we're looking specifically at obstructive sleep apnea, which is going to be the vast majority of patients, maybe 90% of the cases that we see in the office, specifically if you're making a lot of noise, right? You and I are having this conversation. You're not snoring right now. The reason you're not snoring is because your airway is open. There's no airway resistance. All of the musculature is activated, is engaged. When we go to sleep, our muscles naturally relax. And when you think about what's going on physiologically, we have our chest cavity, and outside with the thoracic inlet here, kind of where our clavicles are, above this, now we're getting into the neuromuscular window here. We have pharyngeal muscles that help us swallow, but also control our upper airway. You have muscles in the back of the upper palate. You have the tongue muscle, which when you stick your tongue out is just the tip of the iceberg. That muscle goes all the way down the back of our throat. We also have our ability to breathe through our nose when people can't breathe through their nose and have a lot of sinus congestion. That kind of can cause some increased in upper airway resistance when we go to sleep. It just makes it harder for us to maintain our airway. And so when we go to sleep, our muscles naturally relax. And there are even certain stages of sleep, like rapid eye movement sleep, for example, where all of those muscles are quite literally paralyzed. Our heart's beating, our diaphragms are working, so we're alive. But all of these upper airway, the size of your airway once those muscles are paralyzed is what you got.
Mm-hmm.
And so with obstructive sleep apnea, what's happening is you're having either a complete or near complete closure of the upper airway as a result of those muscles sort of collapsing. And some people have smaller airways than others. How our jaw is shaped, how big our necks are. There's a lot of other factors that go into maintaining our airway. But simply put, your airway collapses either completely or near completely. And guess what? You're now breathing against a closed airway. So you're trying to make an effort, but it's like someone put a plastic bag over your head and duct taped it on. It's kind of a very powerful analogy, but literally you're breathing against a closed airway. What's happening with your oxygen levels? They're going down. What's happening to that nice parasympathetic relaxation state that we're in, low blood pressure, low heart rate? You don't have an airway anymore. Your body's going to sense that. And so there's going to be an activation of our sympathetic nervous system, a little blip, increase in heart rate, increase in blood pressure. We need to maintain that, do a little arousal from sleep to maintain that airway opening. How that can impact what's going on in our head and our headaches is that, well, blood flow. Blood flow changes depending on what our oxygen levels are doing. And so not only do we have an increase in our just general systemic blood pressure, but we also can have an increase in intracranial blood pressure, and which has to do with just how our blood vessels react and respond to our low oxygen state, and probably a bunch of other mechanisms that are either being elucidated or been postulated. But the bottom line is that it translates to your brain sort of seeing that increased pressure, and that can lead you to develop headaches as being a symptom of what's going on with the upper airway when it comes to OSA specifically.
And then when somebody is wearing a CPAP machine, whether it is going into their nostrils or covering their nose and their mouth, that is essentially just pushing a constant stream of air, which encourages that airway to stay, or makes it easier for that airway to naturally stay open so that you're breathing fully and high quality?
So if you think about the upper airway, it's basically like there's going to be that you're going to use pressure, and the airway is going to maybe start to open, but there's going to be what we call a critical opening airway pressure. We're going to, boom, that airway is just now stented open, right? I can't go in and put a physical stent in your airway. It's all musculature, it's all dynamic. So we're using air like a pneumatic stent. We're pushing that tissue open. And once the airway is nice and open, we've now restored normal breathing. Everybody's different. So whatever pressure you might spend, and your doctor may tell you, oh, well, you spend 95% of your time, what we call the P95, on your report at a pressure of 12. I'm making something up, but that's a pretty average pressure. And that just means that that's the amount of pressure you need to keep your airway tissues open. And everybody's a little different. And size sometimes doesn't matter. I can have someone who's, over 300 pounds need a pressure of 8, and a little tiny Asian lady who needs a pressure of 15 to keep her airway open. We're all different. It's, it kind of depends. So it's hard to predict, unfortunately, who needs more pressure versus less. One of the challenges in sleep medicine. I also want people listening who might be scared of the idea of CPAP, and truly, I see them every day in my office. That's a real fear and a real concern. Hey, I don't know that I can sleep with this machine. What can we do? Well, we have a lot of ways to improve your sleep quality and address your sleep apnea. It doesn't have to be one size fits all. And that's kind of why I love sleep medicine right now in 2026. We may even have a pill come 2027. Who knows? So the landscape is just changing and getting really exciting. So please, anyone listening who's kind of knows there's something going on and kind of wants to bury their head in the sand because they haven't exhausted every other headache treatment modality, but sleep apnea is there and they're just really scared of how to treat it, just know you have many options. So don't poo-poo it. Get that information, because it could really, again, getting back to just living your life maximally and as pain-free as humanly possible. All of us have had a headache. I, fortunately, from my lips to God's ears, do not have a history of migraines, but I've had days where I may have had a headache for several days. It very sporadically. I've never required a lot of treatment for it. I am blessed. And those people that are attracted and listening to this conversation right now, they're not so blessed. I got other issues. I have trouble sleeping. We all have our crosses to bear. But if this is a real kick in the pants in terms of your quality of sleep, address it, And so, because your headache's improving, can you imagine, right? A world where you can actually function during the day and feel good and be present because you're not in pain secretly. Trying to manage that.
Yeah, a life changer, a true life changer. You mentioned technologies, treatments changing and evolving, some of the alternatives to CPAP. I know that when I did my sleep study, again, it was probably 8 years ago, it was kind of like, to be honest, it was kind of a racket, going to a place, being connected to all these wires, trying to sleep, pretending like there's not somebody watching you through a window. Like it was a whole thing. But I know that even that process has come a long way since I did that. And I know there's a lot of home options now. Like, can you give us just a really sort of quick overview of like what a sleep study is like and what options are available, especially ones that you support or recommend?
So there are a number of home sleep apnea testing units that are available. The one caveat with anything that you do in the home is that right now in 2026, the vast majority of insurance plans only will pay for one night of testing.
Mm.
The latest data suggests that if we could track your sleep more longitudinally, maybe even, let's say, over the course of a month, get a few snapshots of what's going on with your sleep, we probably are going to have a better sense of what's real and what's not real. Okay. Meaning that, and I've seen this, it doesn't happen all the time, but I may have a patient where one night they're mild and another night they're moderate, for example. So our sleep apnea can kind of wax and wane. So there are some limitations to home testing in that there is a possibility that we will not get an answer, especially meaning that I'm going to have a negative test, but it may not truly be negative. There may be sleep apnea. It's just that I've missed that sleep apnea using that particular home test device. The classic home sleep apnea testing devices, there's like a band around the chest, there's something that looks like a nasal cannula. This seems very reminiscent for anybody who's had an in-lab sleep study. There's a very kind of similar kind of setup. But other than that, and maybe something that you wear on your wrist with a probe on your finger to check your oxygen levels, it's much less cumbersome than the experience of going to the sleep lab. There are other styles where it might just look like a ring on your finger. There are styles that look like it looks more like a wristwatch with something on your finger. And one of the newer devices that I had the opportunity to see and actually get some really positive feedback from a colleague of mine that I've known that I ran into. I haven't seen the man in 20 years, when we finished pulmonary fellowship, basically. We were chatting and he's now using this device at UCLA. It's a device that just basically sticks on the chest and that's it. So there's all sorts of interesting technology out there. The bottom line is that if you have a negative test and the suspicion is high, multiple people are telling you there's something funky going on with your breathing. Your Apple Watch is flagging you. It usually flags you when there's serious drops in oxygen levels, for example. These are situations where you don't pass go. You then go to the polysomnogram, which is the in-lab study, which is what you had. And that is a lot more labor intensive. That's got a whole bunch of electrodes that are monitoring your brain activity. Typically, all those wires get tethered to a box so that if you do have to get up and use the potty or what have you, they can just disconnect the box and you go and then they just reconnect the box. Back in the day, they had to literally readjust all the wires. You can imagine what that was like. There's leads on the legs, which you're not going to get with a home kit. There's going to be EKG monitoring that's a little bit more, it's not quite a full EKG, but it's definitely more sophisticated than some of the home sleep apnea units that we're using. It's going to give us definitely information about, are you sleeping on your back? Are you sleeping on your side? Is there a difference? We're going to really know your true sleep architecture for that particular evening. Just how much stage 1, stage 2, deep stage 3, rapid eye movement sleep you're getting in a way that home sleep apnea testing often reports it, but it may not really be truly reflective of what's going on. So there are pros and cons to each. You alluded to one, which is we get one shot to do that in-lab study. And if you go and you have what we call the first night effect, where you're like, I'm weirded out. And now I can't sleep. Boom, now I'm limited in the data that I have. Because if you didn't sleep, I'm working with a limited, amount of data. So there are some home polysomnogram companies that are out there. I'm very curious to see where that technology goes in the mainstream. Right now, it's not in the mainstream. but we may eventually even be able to get even more detailed readings in the comfort of your own home, which would be certainly very exciting for the sleep medicine field.
Well, it seems like we're in a really exciting time where technology is changing very quickly, and I hope that means more options, more diverse options, more reliable options that can provide additional detail for folks in the future, both in sleep medicine and in medicine in general. Is there anything that we haven't discussed related to headaches that you were expecting me to ask you about, or that you would like to share with the audience?
If your audience has any specific questions and you want to reach out to me with those specific questions, that could be really fun. I'd be happy to address them because the people that are going to be the ones listening are the ones that are going to be like, wait a minute, you didn't talk about this. So if there's something we missed, please feel free to share. My parting words really are that your headaches may be related to your sleep. So address the sleep, prioritize it if you struggle to do so. At the end of the day, it's going to improve your quality of life. And as I said throughout this podcast, I don't know, if you're somebody like me who's witnessed a lot of death during COVID, for example, and has been a critical care doctor and dealt with, life or death situations on the regular, the one perspective that I have that's deeply ingrained is just how fragile life can be. So why not make the most of it and have the best quality we possibly can? Because health is our true wealth. Nothing else really matters if we don't have our health. And living as headache-controlled a life as we can really impact every other aspect of our life. And if sleep is an issue that needs to be addressed, don't be afraid. I promise we don't bite. We're here to help you.
That's the absolute perfect way to end the conversation. For listeners who want to learn more about Dr. Alison, I will include links in the show notes, but the website is askthesleepmd.com, and would also encourage you to subscribe to her podcast, Sleep is My Waking Passion, which is loaded with great information and value. So, Dr. Alison, thank you so much for spending some time and sharing your wisdom. This has really been delightful.
You're welcome. It's a pleasure meeting you, Adam.
Wearing a CPAP machine is kind of a drag, and unfortunately for me, it wasn't the cure for my headaches. But until a better technology comes along that can keep my sleep interruptions down, I'll continue to use it to prolong my life and keep my wife happy since I'm not snoring when I have it on. Have you ever thought about whether your sleep could be impacting your headaches? Maybe this episode will inspire you to explore that. And like I said at the beginning, if you know another headache or migraine sufferer who would benefit from hearing this, please share this episode with them. It's so easy, you could text it to them in about 5 seconds. In our next episode, we'll learn about the many different types of headache medications, including some tried and true medicines that have been around for a long time, and promising new ones that will be available in the future. I sincerely hope this episode has helped you in some way. My name is Adam Flaherty, and thank you for joining me on this headache journey.